This is part of a series on avoiding old-fashioned dentistry.
Okay, and I appreciate what you said about down to earth. We call that conservative dentistry. The most important ingredient in modern dentistry is thinking and discretion. Any dentist can be quick to drill, but you want to be conservative. You want to save as much of that tooth as possible, so if there's a problem 10 years from now, then there's something of the tooth left that we can do a crown. If you keep whittling the tooth down, you end up with nothing.
Yeah, I've always felt, and I've always asked my dentist, if you keep on taking away from the tooth, there will be a problem at some point.
And I've been doing that since 1976, using adhesive dentistry to stick to the tooth and not try to take away healthy tooth structure.
Well, the thing is, I had a dentist who I just wanted a new filling, and he told me I need a root canal treatment and a crown.
Really?
So I didn't believe that. I figured it's really just a filling because I had lost my filling.
And what we do?
Did the sedative filling first.
We went slow, we put a temporary in.
Calm the tooth down, and then you put the filling in. The filling is fantastic.
Thank you. And you don't need a root canal.
No. Okay.
And that's an informed patient. Patients are catching on. She just knew that the tooth didn't need a root canal and a crown. Thank you.
Thank you.
Years ago, this tooth had an amalgam. Years later, we can see its counterpart on the other side remains untouched, unstained, no decay. This means that probably this filling wasn't needed. And certainly the baby boomer patient would have been better off getting a sealant in the beginning or conservative bonding, because this amalgam will have many years of increased longevity to match the endurance of this natural tooth versus tooth decay.
I went to 3 different dentists. All of them recommended a very complicated, expensive procedure.
Was it crowns?
It was crowns, root canal and a crown, as a matter of fact, yes. And then it was in 2000, and I came here to Dr. Larrick's, and he said I can do this in a more down-to-earth way, and that tooth has held for 8 years without a problem.
Well, thank you. That means we're in 2008, and you're a happy guy. Bonding that came out, but you admit to writing something hard, huh?
Yes.
So the beauty of bonding, it's very easy to repair, and we'll just put it back, and we're still friends. And by having an educated patient, they know that there's no problem. Now, because this is so easy to do, I'm just going to use some air abrasion and dust that tooth off like that. Was that easy? Okay, no needles, no nothing. We're going to clean it up and etch it and bond. About 5 minutes?
5 minutes.
You want a dentist who's optimistic and who can repair a tooth in a conservative way. That's why we go through an education program like that, explaining when we adjust the bite and when we do conservative bonding that less is best. You try that first.
The best preventive dentistry is discretion and a conservative philosophy. The metal can be eliminated by applying sealants to fill crevices where food debris could collect. This deters decay.
The question about traditional dentistry causes more dentistry. I just hadn't ever thought about that. It's strange that a traditional dentist would say that about his practice.
That's it, because I'm not a traditional dentist. This is a patient in the middle of the molar life cycle. He has crowns on the right molars and large amalgams on the left. One of the large amalgams has deteriorated with decay and small breakage. It can be seen where the filling meets the tooth. This patient can slow down the molar life cycle by replacing those amalgams with conservative bonding, so he can postpone invasive crowns and prevent a root canal, which is sometimes caused by drilling too deep into the tooth for a crown. That's how to block the molar life cycle from continuing.
And so she started doing some restoration work, and while I was being sedated, she said she was going to put a crown on, after she filled a couple teeth over here. So we'll just get this tooth ready for a crown. Before I had time to even know what she was doing, she was already preparing it for a crown. I know that I don't need a crown, it's just a small crack, and I wanted to have bonding in it. And she just kept moving along and didn't even really ask me what I wanted, but I don't think I need a crown.
You're an informed patient. Bonding is a lot more kinder to the tooth. You don't have to drill as much as metal. The tooth doesn't get up in the morning and say, I need a crown today. It's all in the eye of the beholder. So rather than making a larger metal filling, one way you can contain the process and save the tooth, conservative dentistry, ecology of enamel, is by doing adhesive bonding.
Okay, what would you bond it with?
Good question. I use modern space-age quartz polymers that you etch the tooth and it sticks to the tooth. And a light is used to make the material set up, and it's much more kind to the tooth than having metal in your mouth.
How does it last compared to?
Another great question. There's no guarantees with the human body. But the idea is that if you're conservative and if the bonding does fail, number one, it's easy to redo and just put it back on and try again. Or you haven't overcut the tooth so you can prevent or try to contain the breakage and prevent having to do a crown. It's optimism and saying this bonding is going to work versus, well, let's just do it the traditional way and cut the whole tooth down. This middle-aged patient has never needed a filling in any of her lower teeth. You can see this nice little lady of 55 years old. All her upper teeth are intact except for one, and that's been filled, the filling lost, and the filling kept getting bigger. You can take a look at its counterpart, the same tooth over here, and you could see this is the natural state, because these two teeth should match. This is the natural state of what that tooth would be had it not been drilled. Now, hindsight is wonderful. It's easy to go back and say it wasn't necessary. The only tooth in this patient's mouth that's had dentistry has been drilled down to a shell. That's how we say dentistry can cause more dentistry. You can slow down the ultimate solution by getting bonding as an alternative to old-fashioned crowns. We've cleaned out the tooth with the lost filling with gentle air abrasion, no drilling, and covered it with bonding. You can see how the bonding covers the whole tooth, keeping it intact and bringing the tooth together rather than weakening it. I made the bonding a little bit lighter so you can see. This is how you can avoid and postpone a crown till it's absolutely necessary by getting conservative bonding. Now look at it as what's weak is gone, is broke, and what's left is strong.
Yes.
So we can build to that tooth. That's called conservative dentistry. And we are able to do without any anesthesia. Remember I told you I'd take you for a ride? How was that? Fun?
Well, it was a very pleasant journey.
Thank you.
So,
I couldn't ask for any more. We did it without any anesthesia.
that's right.
And it took us about what? 5 minutes.
No time at all.
Thank you. I was in and out, but yeah. And one visit.
That's right. One visit instead of perhaps 3.
Right. You know, we were talking, and I said I'd surprise you. Life, and by the way, you and I both have been around. You've been to other dentists,
Yes.
and you've had other work done, so I think you appreciate the minimalism. And here's why. You used to be the expression death and taxes, and I really think it's teeth and taxes. And by that I mean, as long as you're alive, you're going to be taking care of your teeth, even if they're artificial teeth. They get worn out. Tooth decay is not just germs, it's also wear and tear.